Welcome to Arden Wood. Welcome to Arden Wood Presents on Zoom. And thank you all 351 of you who registered for joining us today. I'm John Mitchell, and I serve as Executive Director and CEO of Arden Wood here in San Francisco. You know, for generations, Arden Wood has been a refuge for Christian Scientists and their families. It's been fondly called a healing house, where there's an expectation of quick and whole healing for anyone who comes for care. It's also a Christian Science nurses training center, and it's a beautiful residence for Christian Scientists who are fully and happily engaged in ageless living. Most of all, Arden Wood is an idea that has evolved seamlessly over many generations, and it will continue to evolve to meet the specific needs in ever-changing times. Arden Wood exists because you value a place where you are free to have a healing through the practice and application of Christian Science. Webinars like this one and the 3 estate planning webinars last month and the Evan McDonald Bible Talk 2 weeks ago are our gifts to you for all that you do throughout the year to support our healing mission. Thank you. And by the way, you can see a replay of Evan's talk until this Saturday, November 21st. If you haven't seen it, we highly recommend it. Arden Wood is a 501c3 charitable nonprofit organization. This means it requires income from our patients, residents, and guests, as well as donations from you to meet our operating expenses. You are invaluable to Arden Wood. Your support enables us to offer uninterrupted services, something we've been doing since 1930. In return, we want to provide you with the best possible care and informative as well as inspiring programs. You truly bring out the best in us. I want to be sure you know about a very special Arden Wood tradition, our annual Christmas celebration. This year, for the very first time, it's done entirely online. Always held the first Sunday of December, this event marks the beginning of our Christmas season. It's our very favorite activity to share heart to heart each year. In fact, the theme of our program is Opening Hearts to the Christ. It will be a wonderful concert featuring both familiar and new voices and musicians. You can register right now on our website, ardenwood.org, on our homepage. Finally, the content shared today is only informational and is not intended to be legal advice. And now let me introduce today's presenters, Jim Maher and Lesleah DeFrisco. I understand that several of you have talked with Jim and Lesleah since last week's webinar. That's great. Feel free to be in touch with them or Roger Speer with any additional questions. Their contact information will appear on the screen at the very end of this webinar. Also, due to the level of interest in understanding your healthcare options, we are planning a follow-up webinar in early January. One of the main topics of that event will be long-term care. We'll email you with the details in the next few weeks. And please tell your friends. Jim Maher is a certified senior advisor and a broker consultant specializing in Medicare. He's been helping individuals and companies navigate Medicare since 1989. He is a frequent guest speaker at law firms, CPAs, medical groups, school districts, Rotary clubs, and both small and large companies. Jim is also a certified long-term care insurance specialist. He specializes in helping human resource professionals with their Medicare questions regarding current employees and how Medicare integrates with retirees and COBRA. Jim lives in Lincoln, California, just north of Sacramento, with his wife Teddy of 34 years and their spoiled rat terriers. Lesleah DeFrisco is Arden Wood's Director of Christian Science Nursing Services. Lesleah oversees everything related to Christian Science nursing here, and currently she also heads up our nurses training program. Leslie graduated from the Mother Church's training program and has been journalisted since 1981. One of Leslie's responsibilities is to work with Medicare to ensure proper coverage for our patients who choose to use their Medicare benefit. In this regard, she is an unsung hero for her diligence and competence in wading through the intricacies of Medicare. She is joined in this effort by another Arden Wood colleague, Rogers Speer, who processes our Medicare and supplemental insurance paperwork. Rogers will join Jim and Leslie during the Q&A period. Arden Wood is one of 10 Medicare Part A Christian Science nursing facilities in the United States. Because our audience is nationwide, for this webinar, we will provide a list of the other 9 facilities in an email following this presentation. And before I turn the program over to Jim and Leslie, let me explain how you can ask questions. We already have a whole bunch of them from last week. If you look at the bottom of your Zoom screen, you'll see an icon that says Q&A. Click on it and a screen will appear where you can type in a question. Then press submit and it will arrive here. We will collect them and save them for the end of the presentation. Based on the number of questions we received last week, we will extend today's webinar until 5:30 in order to answer as many as we can. Please join me now in welcoming Jim and Leslie.
Christian Science nursing does not include any kind of medical care, but provides practical and skillful care for individuals that are fully relying on God for healing. Christian Science nurses are not just personal caregivers. We do much more than assisting with bathing and mobility, cleansing and bandaging, and making you comfortable. We are spiritual witnesses, beholding the perfect man, expecting quick and whole healing, and taking a stand for the ever-present healing power of the Christ. We are part of the healing team, including the patient and the Christian Science practitioner. Over the years, I've seen that many Christian scientists don't know if they have Medicare or insurance, or know that they can use it at a facility like Arden Wood. So now, Jim and I are going to be giving you lots of information. Jim is going to talk about Medicare, and I'm going to talk about how Medicare works in a Christian Science nursing facility.
Very good. Thank you, Leslie. Hi, everyone. Can you see my screen okay, hopefully?
I can.
Yes? Good. Beautiful. Okay. So that's people when they come into my office and they're looking at Medicare, they go, gee, I don't know which way to go. Do I go left? Do I go right? So it's a very difficult subject. This is just some basics about me. John already told you, I've been doing this 32 years. I love talking about Medicare. I could do it 24/7. I absolutely love it. I'm not affiliated with Medicare, Social Security, any government agencies. So that's a good thing for you. I do get excited if I start talking too fast, somebody just reel me in, but I love talking about it. And we have so many items to go over. So I'm going to go through some and let me know if we need to back up or if you have questions. Medicare updates for 2021. Can you believe there's over 62 million people on Medicare? That's a lot. By 2050, look at that, 31 million people ages 80 plus and 8 million people in their 90s and 100s. So Medicare is growing like this, right? All the baby boomers are coming in. So there's more and more people using Medicare. And it's very misunderstood. And I'm going to try and cover some of the basics. And Leslie is going to help me because I don't understand all the Christian scientists. I'm trying. So help me there. And I never mean to offend. So if I say something or put my foot in my mouth, you know, it's not intentional. So I'm going to go over the basics. And we're going to start with the open enrollment period right now. So I probably don't need to go over much because every time you turn on your TV, right, you're seeing an ad, something about whether it's Joe Namath talking about the newest Medicare Advantage plan, how you can buy these plans. There's zero or little premium. They're great. You should buy your plan right away. So during this open enrollment period, they've changed some of the names. It used to be simple. Now they call it the annual election period or the annual enrollment period. And it runs from October 15th through December 7th. I don't know why they couldn't make it easier. They couldn't say October 1 to December 31st. They don't do that. So that allows people that already have plans, like many of you on the meeting today, you have plans. Certain types of plans you can change during the open enrollment period, and it starts January 1st. That's the new effective date. So what is Medicare? Medicare is our national healthcare plan for people 65 and older or under 65 with certain type disabilities. And the reason why everybody needs to get it, because it's government-run insurance, and that's how insurance works. So they require everyone to do it. And if you don't want to, they get your attention by fining you. So we don't want that to happen. This is what the old Medicare cards look like right now. And you can see on there under the Medicare claim number, that used to be your Social Security number. Well, they changed. They changed a year or so ago, but everybody should have this new card. If you don't, so if you see your mom and dad or an aunt or an uncle or a neighbor and they have that old card, they need to call 1-800-MEDICARE and get an updated card. You can see on there now under John Smith's name, they have an 11-digit encrypted number that coincides with who you are. So it's important, and I still see some people that have them because they don't open mail or they don't trust anything. So if you run into someone and they have that old card, they need to get rid of it and get the new card. So let's talk about Medicare enrollment periods. We're going to talk about why you must enroll or you're going to pay a fine. So everybody at 65 must sign up for Medicare, and there's one exception. So the exception is if you're a spouse or covered on a group plan. So if you're still working or a spouse, then you're okay, you're protected. If not, you must sign up for Medicare, regardless of what your neighbor, your brother-in-law, or your coworker tells you. You have to sign up for Medicare or you're going to pay a fine. So we'll talk about the enrollment periods here. There's 3 times when you can enroll. The first is the initial enrollment period. That's when somebody first turns 65. And I've got a date here on the next slide I'll show you. But the government gives you a 7-month window. So when you turn 64 and a half or 64, you're going to get bombarded with all types of advertisements from insurance companies. Well, there's some important ones in there from CMS or Social Security. Anything that's official, you want to keep and open because it could be talking about this. So you have a 7-month window to sign up for both parts A, like Adam, and B, like boy, of Medicare. That's original Medicare. It used to be simple and easy. The second enrollment period is if you're still working and you come off a group plan. The government says you're not going to pay a fine as long as you sign up within a certain period of time. The last enrollment period, I put the acronym BAD. That means not good. Okay, that's bad because you're going to see this guy over here. You don't want that to happen to you. You don't go to jail, but you've got to pay a penalty normally. You don't want that. So we're going to try and teach you today how to avoid that. The initial enrollment period in this example, I'm going to use the April 16th. It's my favorite day because that's after tax day. So that's one of my favorite days. And so if somebody, let's use next year. So if my birthday is April 16th of 1956, I'm going to be turning 65 next year, whether I like it or not. Some people are in denial and they go, well, that's not true, but it is. So the government actually pushes you forward. Your effective date for Medicare would be April 1st. So they said, listen, Jim, you've got 3 months prior to the month I turned 65, which is April, to sign up, or up to 3 months after. That is your initial enrollment period. You don't want to miss it. Special enrollment period, very simple. If you're working for a company and when you decide to come off that group plan, doesn't matter when, it's up to you. Medicare says it's your option. You don't have to wait for the company's open enrollment period. It's when you decide to sign up for Part A and or B. If you're still working, you come off and you create a special enrollment period. And the good thing about that, there's no fine. There's no late enrollment penalty whatsoever. So you're in good shape there. Everybody's happy. They're doing high fives. The last one, and unfortunately, I've talked to some of you folks have called me and said, what's a general enrollment period? Because I called and I asked about when can I sign up for Medicare if I'm late. General enrollment period means you miss both the initial enrollment period when you can first sign up, and if you weren't on a company's plan and you weren't eligible for a special enrollment period, you fall to the general enrollment period. And you know my little friend there, why he's got a headache? Because he knows he's going to be fined. And the fines, they're not good. So we want to avoid that. The general enrollment period is every year between January 1 to March 31st. So if you miss it, you miss one of those enrollment periods, they force you to wait till the following year. and then your coverage is effective July 1. So sometimes I see in that example of April, well, that's a full 12-month period. So guess what happens? You see that penalty? Well, you may be subject to that late enrollment penalty. For example, on Part B, like boy, that's the medical side. That's the doctor side of Medicare. I would pay 10% for every 12-month period that I should have signed up and I didn't. But here's the bad thing, those fines, the $14.80 a month for next year, it's not just for 1 month, it's forever. It'll last forever. So you don't want to have that happen to you. The Part D is a prescription drug plan and the government says it's voluntary, but if you don't sign up, they're going to fine you. So I don't know how that's voluntary, but according to them, that's a voluntary program. Now I've got some slides on that. We'll talk about that in a little bit. Again, the penalties are forever. So you don't want that to happen to you. So Leslie, a good question people ask me all the time is, well, how do I sign up and where do I go? Well, if you're going out and looking for a Medicare office out there, you're never going to find one because there are no Medicare offices. The most difficult thing is to remember that when you're signing up for Medicare, you actually do that through Social Security, not Medicare. You do it through Social Security. You're going to see 3 initials, CMS, that stands for Centers for Medicare and Medicaid Services. They're the administrator. So when you get something from them or Health and Human Services or Social Security, it's not junk mail. So you want to keep that. You don't want to throw that away. So how do you sign up? They took one of these options away right now. It used to be simple because you could always go down to your Social Security office. Because of the COVID, they've shut down all their offices. The easiest way is to simply jump online and you can go to the Social Security website, which is 3 initials, ssa.gov, and you click on, they've got a big Medicare button and you click on Medicare and you can enroll. It should take you no more than 10 to 15 minutes to do that. If you get stuck or you don't want to do it online right now, you're going to have to call the 800 number. And you can see it on the screen there, 800-772-1213. Want to make sure you're on speakerphone because you may be on hold for a little bit. But ultimately, they're very good about helping you. Their goal is to help you enroll, and they're pretty good about that. Here's the other thing. I have people come into my office all the time and they go, well, I'm not sure if I sign up, but I have this envelope here from the government. I said, well, we should open that from CMS. And lo and behold, there's their Medicare card. They go, well, how did that happen? I didn't do anything. Well, that tells me they're already on Social Security. It's the only way that you're going to get a Medicare card in the mail. That or railroad retirement. If you're on that, they also send you a card. And that's big up here. I'm in the Sacramento, Roseville, Rockland area, and there's a lot of railroad retirees up here. So you automatically get sent that card. All right. We're going to talk briefly about the 4 parts of Medicare, and this is where Leslie's going to come in and help me with all the Christian Scientists, because I'm good on the outside, but I'm not good with the Christian Scientists. So Leslie, you let me know when we start Part A here. There's 2 parts. The original Medicare is Part A, like Adam. That's the hospital side. Okay, it covers you for inpatient care in a hospital, a skilled nursing facility. And for non-Christian Scientists, I just want to make sure everybody understands it does not cover long-term care. I don't care how many times your brother-in-law tells you that it does. It does not cover long-term care. It covers skilled care. Do you want to jump in here, Leslie, or should I?
Why don't you finish your part on Part A and then I'll jump in and how it applies here.
Okay, so fantastic. So I always look at Part A as kind of the accommodation side to Medicare. You're going to spend the night somewhere, whether it's inpatient in a hospital, in a skilled nursing facility, hospice is end of life care, you're going to be at home, hopefully, or some type of home care. So I always say A is accommodation side of Medicare. Well, how much does it cost? This is my biggest pet peeve because I'm so tired of everyone saying, well, it doesn't cost anything, it's free. It's not free. They don't charge you an additional premium when you go on to Medicare Part A. So it's referred to as premium free. This is what happens when you work every month, every week, whenever you get a paycheck, they take out 1.45%, and you don't think it's very much. If you want to see how much free really costs you, when you look at your Social Security statement, on the right-hand side under hospital, you're going to see a big number. That's exactly how much free has cost you all these years.
Now I'm going to jump in. The part at the top where it says hospitals and skilled nursing facilities, that is the part that applies at a facility like Arden Wood. Medicare has certified us and a few other Christian Science facilities as a religious non-medical healthcare institution, a RINCI. So that's the name they've given us, but we do have accommodation, and it is a combination of both hospitalization and skilled nursing. However, it does not include, we do not have hospice care, nor does Medicare cover home health care for Christian Science nursing. It does cover it if you're under medical care, but not for Christian Science nursing. But it's not just enough that you're 65 or over, you have to require skilled Christian Science nursing care. And that determination is made upon inquiry and assessment that we would do to determine that the care was indeed skilled and not light care or, as Jim said, long-term care. That does not qualify for Medicare coverage.
So next we're going to talk about, oh, I'm sorry, Leslie, did I cut you off? So now we're going to talk about Part B as in boy. That's the medical side of Medicare. So I'm going to just open up the whole screen here so you can see what Part B covers. Basically any medical necessity, whether you see the doctor in his office, lab work, x-rays, MRIs, CAT scans, it doesn't matter where you see him, doctor's office, hospital, clinic. And it works like this. It was so simple in the beginning. It's original Medicare. You can go to any doctor, hospital provider throughout the United States. And with Part B, if you don't have supplemental coverage, the government says, listen, you've got to pay the first $203. So if Leslie's on, well, she's too young, but if I'm on Medicare next year and I go to the doctor and I have Part B and I don't have any insurance, I'm going to pay up to the first $203, whether I see the doctor, I have lab work or x-rays. Once I hit or pierce that $203, the government says, well, good deal, Jim. We're going to pay 80% and you're going to pay 20%. And you go, well, that's not bad. If I had a doctor's office and it was $100, well, $20 is no big deal. I don't mind paying that. Here's the catch. Here's what you have to be careful of. There's no cap. There's no out-of-pocket maximum. Most plans, when you're under 65, they all have a cap. You're never going to pay more than X, $6,000 or $7,000. Doesn't matter if you're in Stanford Hospital and you've got a $180,000 bill after a week. You have a cap. With Part B, you have to be careful because there is no cap. For example, I had outpatient knee surgery a couple years ago to remove a piece of cartilage, and 8 hours in the hospital was $64,000. I was shocked, but that would be covered under Part B because it's outpatient surgery. So for that, they would say, well, listen, that hospital can't charge you that full $63,000. They can only charge you a Medicare approved rate of, let's say, I don't know, whatever, $50,000 or $40,000. Well, I have to pay 20% of that. And if it's $50,000, that's $10,000 and there's no cap. If I have to go back in and have other outpatient surgeries or anything under Part B, I continue to pay that the rest of the year. That's why most people turn to some type of insurance product, whether it's a supplement or an advantage, and we'll talk about that. But first, everybody wants to know the cost. How much does this cost? And this is hot off the press. These are the new premiums for 2021. Most people, 94% of people out there are going to pay $148.50 a month. If you're on Social Security, they automatically take that out of your monthly deposit. If not, the government bills you quarterly. That's how they do. If you have higher income, the government says, we really like you because you're going to pay more. It's called an IRMA, an income-related monthly adjustment amount. Essentially, they pull your tax return from 2 years ago. So for 2021, they're going to be looking at your 2019 tax return at your modified adjusted gross income. And they're going to look at that number. And for example, if you're filing a joint return, you'll see the middle column there. If I made $180,000, well, the government's going to charge me more. They're not going to charge me $148.50. So they look at that every year for you. So for 2022, they'll be looking at your 2020 tax return. Not that they don't trust you and take your word for it, but you've got, Medicare, Social Security, and then you have the IRS, the Department of Treasury. So they all share that information just to make sure you're paying your fair share. So now we're going to talk about some insurance options here. And I changed the order. Go ahead, Leslie, I'm sorry.
I'd like to jump in. So Part A Medicare is the part that everyone has. Part B, you can choose to have or not choose to have. And as a Christian Scientist, you might be thinking, well, gosh, I'm never going to need that because that's medical care. But let me just remind you where it might be handy. If you were ended up in an emergency room, if you were in a car accident, if someone called 911, if you chose to have x-rays, there's a number of situations that we never anticipate we might need, and we might just need that Medicare Part B. And as Jim will tell you, it's also required if you're going to have a Medicare supplemental policy. So it is really something to consider.
That's super important. Thank you, Leslie. So now we're going to talk about, I did this in reverse. I flip-flopped. I'm going to go to my favorite option here, which is the Medicare supplement. So once you have parts A and B, you can decide to get a supplemental plan if you like. Part D, which I know Christian Scientists don't believe in the prescription drugs, but the government says, listen, if you don't buy it, we're going to fine you. So I just want to throw that out there so you understand, even though it's voluntary, the government says we're going to fine you if you don't purchase it. So we're going to talk about go ahead, Leslie.
There's only a fine if you actually opt to use it later, correct?
That's correct, right. So if I didn't sign up for it when I was 65 and I wait till I'm 80, and if I do need it and I sign up for it, then you would pay a fine. They would multiply that by those 15 years by 12 months each year and fine you each month. But if you never sign up for it, that's correct, Leslie. Yeah, that is absolutely true. And that's the problem too. Remind me when we talk about the Medicare Advantage plans, because that's kind of sneaky how they do that in there. And that's how people get fined, by the way. So let's stay on the Medicare supplement plans, otherwise known as Medigap plans. It all means the same thing. These are contracts from insurance companies out there, and there's several of them. There's a lot of good ones, and there's a lot of not so good ones out there, so you have to be careful. But all the policies are guaranteed renewable. In other words, they can't cancel your policy because you're using it so much. I have a lot of people that are worried, gee, if I have a big claim, can they single me out and cancel me? No, they can't. They're guaranteed renewable. And in California, here they have a special deal called the 30-day birthday rule. So as we age, every year we get a little bit older. Some of these supplement policies, they tick up a little bit every year because they're based on age. California has a special deal, which is really kind of neat, where they'll allow you to change your policy every year from whatever company ABC to XYZ, whatever supplemental plan you have. And there's no waiting periods or pre-existing conditions. And I'm going to show you the most popular plans, because most of you I talked to, have talked to several of you, most of you have one or two of these plans. These are the plans that are available nationwide. Not all states, some states have different rules. Massachusetts and a couple, Wisconsin, they have a couple different rules. But most everybody else, these are the standardized plans. Plan F like Frank, a Medicare supplement plan like F like Frank, was so easy for people. Once you get that plan, it pays 100% of whatever Medicare approves. Doesn't matter. On the Part A side for the hospital inpatient, on the Part B side, the doctor side. Plan F has gone away. So this is something that people get confused about because they're coming over and saying, well, you can't buy Plan F anymore. Well, you actually can. So if you were 65 prior to January 1 of 2020 this year, you can still purchase Plan F. Okay, it's still out there, and it's one of my favorite plans. If people don't like any hassles, it's simple and easy. Plan G like George is the next plan, and it's just about like Plan F with one exception. Remember we looked at that slide where next year you'd pay the first $203 if you went to the doctor? Well, Plan G says, listen, we're going to charge you a little bit less than Plan F, but you're going to pay that first $203, whether, like Leslie said, if it's outpatient surgery, lab work, x-rays, you pay that, and then Plan G works like Plan F, and it pays 100% of whatever Medicare approves. So I get that question all the time from people calling me saying, can I still get it? It depends when you turn 65. I usually don't promote companies here because I'm an independent broker consultant. So, but I had to share this with you because this is a big deal right now. As you age, some of the companies out there in California or nationwide that have a color as their first name, not purple, but probably blue. As you age, they get very expensive. So I've seen people with Plan Fs paying $350, $375. So as you age, they go up. But you know what happens is people don't know they can change. They get afraid. They have fear going, well, gee, if I change, what if they don't take me? Or what if there's a pre-existing condition? But I'm going to show you something here. Why change? Guess what? All Plan Fs are the same, whether it's company A, B, C, or XYZ, or all Plan Gs are the same. It's by federal law. The only thing that you do is you can save some money, right? I mean, real life example of the individual I saw, she was paying $347. And I just simply moved her to a Plan F with, it happened to be the AARP plan because they have this special deal right now. And I think she was down into the 260s for the exact same plan. And by the way, I needed her niece to come out because she was in her 80s and she didn't quite believe me, right? If it sounds too good to be true, it normally is. In this case, it's not. So normally I never promote a company, but they have a deal on right now. You don't have to wait until your birthday, but you can change. So I just wanted to put that out there. You can talk to your agent or broker, whoever, and that may help you right now. So, okay, Leslie.
A little bit. If you have an older insurance plan that has a Christian Science rider, that means that you very specified and it will cover a Christian Science nursing. You want to hang on to that. It's very difficult to get a rider, a Christian Science rider nowadays. And if you in particular have an SCS, Serving Christian Scientists policy, it will still be honored, but they are not writing them anymore. So just good for you to know.
Thank you, Leslie. So now we're going to talk about the option that a lot of people have and they don't think they have, and they don't think they're going to pay a penalty on Part D, all right? And I reverse them. So this is option one, it doesn't matter. But these are the ones you see on TV. They're called Part C Medicare Advantage plans. And they're really easy to sell because they sell them all day on TV and people call me and say, I want to get that one on TV because it costs zero premium, low premium. I can get car rides, I can get everything. It's all built into one package, and it's a great plan. Well, they just don't tell you the whole story because they can be very good for some people, but you have to understand how they work. Most all Medicare Advantage plans, anything you see on TV, anything that has an initial like an HMO, PPO, anything like that, are Part C Medicare plans. You've got to have both like Leslie said, you've got to have both Part A and B of Medicare to get these plans through an insurance company. Well, how in the world can somebody pay $800, $1,200, $1,500 when they're age 64 and they turn 65 and they say, hey, congratulations, welcome to Medicare. You're going to pay zero premium or $24 a month. It's because the government subsidizes the insurance companies. They're highly profitable for insurance companies, all of them. That's why they can offer zero premium. So for example, if the government's paying $1,000 a month or $12,000 a year, you still would have Medicare, but you're going to be receiving all your services through, you just name the ads on TV, Humana, AARP, Kaiser, Blue Cross, Aetna. They're all telling you we have the greatest plans, right? They're more concerned that you buy something with them and instead of explaining exactly how it works. It's easy and low cost. This is why people buy them, right? Okay, how can you lose? If I'm talking to John, how can you lose? It's $19 a month. You get everything on here. Most plans include the prescription Part D plan. They're built in. That's where the problem, when Leslie was talking about the fines, right? It's a voluntary, you don't have to get it. On these plans, if it's included in that bundle, it's all wrapped together. Guess what? If you haven't had any Part D plan and let's say you wait to 70 and you say, you know what, I think I'm going to get one of these plans. They look pretty enticing. Well, guess what the government's going to do? Once you sign up for that, technically you're signing up for that Part D plan. Well, that's 5 years. That's 60 months times 33 cents a month. That's what they're going to fine you. And that fine starts in month 1 and it lasts forever. It doesn't go away. So you have to be very careful because I have talked to some out there and they weren't aware of that. Because if I tell you that up front, a lot of people aren't going to buy the plan. They have a lot of new bells and whistles for 2021. I just want you to understand one thing, that most of the HMO plans work like this, where you have a primary care physician and you stay within a network of doctors and hospitals. Here's what they forget to tell you, that it's restrictive, right? that you can only stay within a certain group, that you can't go wherever you want. I want to show you something how Original Medicare works. Original Medicare right now, you can go to any doctor, hospital provider throughout the United States or its territories also. So that's huge, right? There's no list. There's 1 million+ providers out there. So if I'm traveling, if I'm seeing my family in Miami, Florida, or Austin, Texas, or Cedar Rapids, Iowa, I don't have to worry about it. I can just simply pick up the phone. I don't need a referral and call and make an appointment. I don't have to worry about PPO, HMO, HSA, nothing like that. So you've got the entire United States. When you sign up for a Medicare Advantage, here's what they need to tell you, and they often forget, it's restricted. I wanted to show you, I live outside of Sacramento, California. So if I sign up for one of the HMOs here, and there's all kinds of them here that are 0 premium or $19 or $18 a month, remember, I'm receiving all my care within one medical group, one certain area. I think as people age, I really like to have freedom of choice. That's just me personally. But you have to be careful because they don't tell you this when you purchase these. And then people want to find out, Leslie, they go, well, how do I get out of this thing? I signed up for it, now I want to get out of it. So I'm going to tell you how to do that. Go ahead.
Is this a good time for me to talk about the disadvantage?
Absolutely, yes. Let me go back there.
The disadvantage is that you basically, if you had Original Medicare and you signed up for an HMO, you've reassigned your benefits. And the challenge is the law says they are supposed to cover everything that Original Medicare does, and then they throw in some fun extra things that are very appealing. Original Medicare does cover care in a RINCI, religious non-medical healthcare institution, but the Medicare Advantage plans don't understand that. So they don't understand that they are supposed to be paying for the care in a Christian Science nursing facility. So when we've had individuals come, and we've had several over the last few years, it's very challenging to try to get them to pay. It's requesting authorization. We don't speak the same language. They don't understand. So we have had some wonderful successes, but mostly it's been on appeal and with a lot of extra help from some Christian Science attorneys and a lot of prayer. So I'm just letting you know that up front.
Yes, that's important. Because the commercials, they don't tell you that, right, Leslie? They just tell you how great it is, and they don't tell you anything about restrictive networks. So you think you've heard all the enrollment periods, and then last year they started a new one. They said, listen, if this one's not confusing enough, we're going to give you a new Medicare Advantage open enrollment period starting in January. And you go, what does that mean? Well, the government says, listen, if you signed up for one of these Medicare Advantage plans that you see on TV advertised all the time, and you want to change, so if I sign up with company ABC and I want to go back to company XYZ, or it doesn't matter where, you can do that. And this new Medicare Advantage plan opens January 1 through March 31st. So it allows you to also to do a do-over. I don't know why they do that, but you can. But here's what it also allows you to do. I've talked to several of you out there, and it allows you to say, well, listen, how do I switch my plan? I don't want to be on that plan any longer, Jim. What do I need to do? Well, you can switch back to Original Medicare. Part A, the hospital side. Part B, like boy, is the medical side. You can switch back to that, right? But the supplemental coverage we talked about, like Plan F or G, it's not guaranteed. So a lot of times you have to qualify medically. Well, what's that mean? Well, you don't have to take an exam or anything, but there's usually some insurance companies are pretty liberal. They may have 6 to 8 questions they ask you to see if you qualify health-wise. Because believe it or not, there's still pre-existing conditions in Medicare. When the Affordable Care Act started, it took out pre-existing conditions under 65, but for Medicare, we have to worry about that. So you would never, ever cancel your Medicare Advantage plan until you look and see if you can get approved for some type of supplemental coverage. That way, if you come back to Original Medicare, right, we know total freedom. You can go to any doctor, hospital, provider, wherever you want. And then we know that if you have your insurance, you're good to go. Whether you want to do that or not, that's totally up to you, right? But that's when you can also disenroll from that. So last part, and oh, go ahead, Leslie.
I'm looking at the clock here and I'm thinking we need to keep moving so we'll have time for all the many questions coming in.
Sure. This one will help too. We're going to finish up with Part D, because Part D talks about prescription drug coverage. Whether you want to buy it or not, the government says it's voluntary, but if you don't, right, they're going to fine you. So all the companies on TV also offer them too, whether it's Humana or anything like that. They also charge you extra premium. So if you're a higher earner, they can charge you additional. I don't care if your plan's $0 or $10 a month. If you have higher income, they're also going to charge you more. And I'd be happy to send this out to you. I've got all these on PDFs, so we can absolutely do that if somebody wants to get a hold of this. So, and that's the fine. You don't think it's much, and if you multiply it by 10 years, 120 months, it's almost $40 a month. Whether that's for the non-Christian scientists, right, Leslie?
Right.
Okay. What's not covered? This is really important because this is what people think is covered. Vision and dental are not covered. Hearing aids, private duty nursing, and most importantly, no long-term care. Long-term care is not covered. Most people and your adult children, when they call me, they think it is, right? Healthcare is focused on getting you healthy. Long-term care is normally about caring, not curing, right? It's about custodial care. And I know we're going to talk about that probably sometime in January, but I just want to make sure people understand that is not covered. So
Jim, I'd like to jump in and to share some additional funding that is available, and that is the National Fund for Christian Science Nursing. It's a very generous fund that's been active the last few years, administered through the Principal Foundation, and they will pay for Christian Science nursing at any level. So whether it is helping in a home situation or in a facility, maybe after your Medicare benefits are exhausted, they have been able to help, or in a long-term care setting. They also can be a big help. So really grateful for that. There also is funding to help for the cost of Christian Science practitioners. Longtime serving Christian Science practitioners and nurses may be eligible for some support from the Mother Church. And many facilities also offer benevolence. So there's lots of other options available to help supplement Medicare or insurance.
Very good. Well, I'm going to put one more slide up here because I know we're going to go over this in January, but I want to show you, that's my contact information. I know you've probably got it on there too. I've talked to several of you after last Zoom meeting. I'm happy to reply by email or try and help you. I'm familiar with a lot of states. Some states I'm not, but I deal in a lot of states. But the plus is Medicare is a federal program. So I can answer questions about Medicare, but if you answer specific questions about Gem in Rhode Island or Massachusetts, is plan, JKL, is it still available? Sometimes I don't know that. So, but I can always research it for you and get back to you. With that said, John, are we ready for Q&A or?
Thank you, Leslie and Jim, for guiding us through the ins and outs of Medicare for Christian Scientists. This is complicated stuff, and we're just grateful you can guide us and navigate these waters. Arden Wood can serve as an ongoing resource in understanding Medicare. So please don't hesitate to call with questions at any time as we stand ready to help. So before we go to your questions, let's take a quick poll. These are really fun and they're informative. So let's take a quick poll. A box will pop up on your screen with 4 questions. You might have to scroll down to see all 4. Last week, people said they couldn't see all 4. Just scroll down, simply click your responses, and Zoom will take care of the rest. And then we'll turn to your questions. So let's just take a quick moment now to do this poll.
And John, we don't want to forget to talk about Advanced Healthcare Directive as well.
Oh, that's right.
Oh, yes. Why don't we take a moment to talk about that now, Leslie, just while we're waiting for these poll results.
Well, that's a good segue. Okay. So it is such an important document to have. It is also known as a living will, a personal directive, advanced directive, medical directive, advanced decision, or healthcare proxy. So we do have a form for Advanced Healthcare Directive available on the Arden Wood website. It is specific to California. It's been vetted by attorneys in California, but the specificity is in that it's for Christian Scientists. So it might be that you could find some language there that worked for you in your state. You also can find generic forms online, and you can just add what you want. The point is that you're having an opportunity to state your choice of care. Really important, whether you want specifically Christian Science care or whether there's some limits to the medical care that you would accept. So by directing someone, identifying someone as your advanced healthcare directive or healthcare proxy, you are authorizing them to help make decisions for you based on your wishes if you are ever unable to speak for yourself. So the other part that is very important is to designate when that should become effective. My experience has been that you would only ask someone that you really trusted, whether it is a family member or a close friend, to serve in that capacity. So to go ahead and authorize them their ability to take effect right now, because if something were to happen in the future, it's very difficult to have someone declared incompetent or we don't want to go there. But if they're unable to make the right decisions, to have someone that can really act for them and make those decisions. It's important too that it not be a Christian Science practitioner or a Christian Science nurse that's caring for you. That's a conflict of interest, but could be a family member. You may choose to not have it a family member, but someone that you know will honor your choice of care. Have a discussion with them, make sure they know that you are asking them to be the agent, make sure you have a copy of it and they have a copy of it. You might even carry a note in your wallet that tells where the Advanced Healthcare Directive is. Have several copies. If you ever find yourself in a medical setting, they are required to ask you if you have it. So that's why it's such a protection for a Christian Scientist. We also at Arden Wood, we will ask if you have one when you come in. It's just so important. I have seen it be useful in helping individuals get out of the hospital when they did not intend to end up there. And without it, they would not have been able to get out. So you just never know, but it's just a good idea to get your affairs in order, and that's such an important thing.
Thank you, Leslie. I can't emphasize enough what Leslie just said. We've seen this time and time again. If there's nothing that is more important today than other than Medicare, if you choose to make Medicare your choice for what we've been talking about today, please make sure you get an advanced healthcare directive. It is one of the most important things you can do.
At all
It is so important. I agree. I see it all the time. Before I forget, I wanted to show people, this is a great guide that you can get, Medicare and You, because a lot of you are going to ask questions, and believe it or not, it's in this publication that government puts out every year. They send it to you. They've got plans, they've got information, and it's free. You can go to medicare.gov and download it to your desktop, or they can send it to you. They also have large print, but it's kind of what my reference guide. So everything there, it will really help because you're going to ask a lot of questions, and many of those questions are in here. So it's a great reference guide for you.
Thank you, Jim. Do we have the results of the poll real quick? There we go.
Yeah.
Do you know if you're registered for Medicare? Was the first question. 93%, that's great. You're registered, well done. Do you have basic Medicare or Medicare Advantage? 69% said they had Medicare, 12% said they had Medicare Advantage, and 19% had neither. I think that was the same as last week. Do you have supplemental insurance? 35% said yes, 65% said no. Do you have an advanced healthcare directive, which we just spoke about? 55% or more than half said yes, 45% said no. I would strongly and finally encourage all of those in the 45%, the 83 folks watching, to do that at your earliest convenience. Let's go to questions, shall we? Some of these are, I think, are pretty quick answers, Jim and Rogers and Leslie. So let's just go through them. Okay. What constitutes supplemental insurance?
What constitutes supplemental coverage? So like we talked about the Medicare supplements, anything that's going to pay or help pay costs, co-pays, deductibles, what original Medicare charges, that would be supplemental coverage, a Medicare supplement, not a Medicare Advantage plan, Medicare supplement.
So if you had original Medicare and a Medicare supplemental plan, it actually could cost you nothing to be in a Christian Science nursing facility. No additional expenses. I'm just throwing that out there.
No, it's a good point. It's a very good point.
It's very helpful. I have Part B. How would I get a supplemental plan?
That's easy. You can go online. You can call me. I can point you in the right direction. You can talk to an agent, a broker. There's so many avenues that you can turn to, but there's a lot of them out there, and you want to make sure you always get what's best for you, not what's best for the insurance company or the broker.
Perfect. I have Plan K, insured by United Healthcare Insurance Company, which comes with under the AARP supplemental plans. Can Plan K be used at Christian Science facilities, particularly Arden Wood?
Yes, all supplementals are fine here. If you have your traditional Part A, and then a supplement to that, as Jim has pointed out, the different letters just sort of tell how much of how much of the deductible you're going to pay, or how much of the personal copayment they're going to ask of you to pay, or but anyhow, all of the supplements are workable here at Arden Wood.
Excellent. Will a supplemental plan cover dental and vision? Some of these again are repeated, right?
No.
I'm
Medicare
65.
doesn't cover dental or vision. So that's what the #1 requested benefit is, but Medicare does not pay for dental or vision. If you're with a company, you want to stay on that as long as possible and do COBRA. There's some individual plans out there, but supplements, most of them do not cover dental or vision.
I'm 65 and on Social Security. Will I be enrolled automatically in Part A and Part B, or just Part A?
Part A and B, you will be automatically enrolled in both, but that doesn't mean you have to keep B. The government requires you to keep Part A because you're receiving Social Security. But if you were still working, for example, you don't have to keep Part B. You would call them and say, I'm still actively working, I don't want Part B.
And some of these you've answered, but I'll just
Give me an easy one, would you, John? It's real easy, softball one. Okay.
Is it possible to add Part A to your existing Part B Medicare plan anytime, or is there a designated calendar block of time to add Part A to the plan? If so, do you contact Social Security directly to make the change to include both Part A and B in the Medicare plan?
Right. Normally it's Part A, it's required, right? If you're receiving Social Security, it's Part B, it's the one that you don't have to take. But Part A is required. So I've never, in 32 years, I've never seen that in reverse. So, but the answer is you would always call Social Security and ask them. They're going to be the one to determine what you can do. And the last thing I want to tell you too about calling a government agency, there's something called equitable relief out there. So if I call, or I listen to my brother-in-law, only because most people go, hey, my brother-in-law told me that I should do this, is it right? I go, no. But if I call Social Security and I'm talking to John, for example, I want to note that, hey, I talked to John M. on November 19th, and John gave me this information. If a government employee gives you misinformation, you can get a do-over, you can get it changed, just in case, right, Rogers? Occasionally they make a mistake. But
Right.
if anybody gives you incorrect information, it's not a government employee, that's kind of it. So.
Perfect. In the general enrollment period between October 7th and December 15th, or between is the general enrollment period between October 7th and December 15th, or between January 1st and March 31st. Also, the penalty is for each 12 months. What penalty comes with 16 months since the non-penalty sign-up period, the 12-month fee, or is it increased each month?
I feel like that should be like a $200 question or something for that. That was a lot. So the general enrollment period, the annual enrollment period, right, is what we're in now, the October 15th through December 7th. If you miss that and you have to re-enroll through the general enrollment period, that starts January 1st through March 31st. So the penalty is 10% for every 12-month period. So 16 months would be one 12-month period. So the government would fine you just the 10% of that for one 12-month period. Did that, I mean, that was a really complicated question.
Exactly. If I'm retired but am enrolled in the large company or in government healthcare plan, must I sign up for Medicare Part A when I turn 65?
No. So if you're on a large group employer with more than 20 employees, you don't need to sign up for Part A and or Part B when you turn 65. As long as you're still full-time working, you or your spouse are on that company's group plan. You don't have to sign up for A and or B at that time.
I'll throw this to all of you.
Yeah, just so you understand, and the reason there'd be no penalty is because when I leave that group plan, let's say I'm going to leave it next June, I can enroll for Part A and B then, and the government says that's a special enrollment period, so they allow me time to sign up for that, and there is no penalty.
Great. What is the difference between home care and hospice?
Who's answering that one? Leslie?
Say that neither one of them is covered for Christian Scientists.
Oh.
Unless it's done by medical. So hospice is you're under the care of a physician.
Exactly.
And you can have Medicare coverage for home care, but only if you're under the direction of a physician. So not a visiting Christian Science nurse.
Right. So if you're receiving home care, that can be covered under both Part A and B of Medicare for skilled home care for a period of time. Hospice is normally when somebody has less than 6 months to live, the physician will order hospice, and it's a great program. I know in the non-Christian Science, but outside they're wonderful. It's all about taking care of the individual, comfort for the family, counseling. I've never seen one that they just do outstanding jobs. All the ones that in my area, they're excellent.
We're all for expecting healing, so not hospice care here.
All right.
We've got a few Part D questions. Please explain Part D. Is it required? I've seen where there is a penalty if one signs up late. Can one choose never to sign up and therefore not be penalized?
Yeah, Leslie did a great job pointing that out earlier. Yeah, if you never sign up for Part D, never, there's never going to be a fine. But the government says, listen, John, we highly recommend that you sign up for Part D. It's voluntary, but if you don't sign up, we're going to fine you. And the fine is 1%. It's not a lot, but I think next year it's going to be 33 cents a month. But if somebody decides after 10 years, say, gee, I'm going to go on to Part D or get remember the Medicare Advantage plans they advertise that includes Part D, the government says, we're going to get you that way too. So they would multiply that 33 cents in that example times 120 months. And that's almost $40 a month that they're going to fine you. But the key is there's other options out there, right? You can look at different areas. You don't have to always rely on the Part D plans to get prescriptions if that's what you end up doing.
And that's only if you want to rely on medication.
Yes.
So just throwing that out there.
Yes.
And some of these are repetitive. I have Part A and B. I don't take prescriptions. Do I still have to get D? We know the answer,
No.
I guess.
No.
Does Jim recommend using the government website to find a Plan D?
Yes, it's excellent. It's Medicare.gov, and you simply click on Part D. It's really easy to get through, prescription drugs, and you can pull it up. You can, for the non-Christian Scientists, they can put in their prescriptions. They can find which plans, co-pays, everything. It's pretty easy to tool around. They've actually made it, you put your zip code in, and you can find which plans may work best for your neighbor who's non-Christian Science. Did I say that right, Leslie?
Christian Scientist.
Christian Scientist. Okay. All right.
You're learning, Jim. You're doing great.
I am.
Medicare Advantage. We're going to switch to that topic now. My mom has United Healthcare Advantage. How do I know if UHA plan is the preferred Medicare supplemental play you suggested?
United Healthcare, AARP endorses United Healthcare. So they have both Medicare supplements and then Medicare Advantage plans. Medicare Advantage plans are the Part C ones. Those are the more restrictive ones. I will say this, I think you know, I'm not here to endorse companies, but I do think they're one of the better ones. So, but you always can look around. You don't have to say I'm stuck in that plan. You can change now from company to company, or again, starting January 1 through March 31st. If you say, gee, I should have changed and I didn't, you've got a chance to do a do-over and do it again. So, but I do think they're a quality company.
But you also
If I
want
can
to
jump, go ahead. Sorry, Leslie.
you just want to look at the card and find out which one is it. Is it a Medicare supplemental or is it an HMO? Because it makes a
Right.
difference.
Right. And I was just gonna say, just by the way that question was, definitely look, you know, there is the difference there. Supplemental is used with Part A and B, and Medicare Advantage is Part C, and it's a totally different thing. And I do know, talking with people that give me calls all the time, they're really confused, commonly interlinked, and well, gee, you know, blah, blah, blah. No, you know, the two things, supplementals go with A and B. The Medicare Advantage is that C.
That's right. And normally too, what they'll do is they'll put, if you have a Medicare Advantage card, an HMO type, they're going to put a primary care physician on the front of it. So normally they'll have your doctor. So that's how you can look to see if I have a Medicare Advantage plan. If you have a supplemental plan, you'll probably see a letter on there like F or G, or you mentioned K or N or something like that.
This follows on to the previous one. Does Jim feel that United Healthcare would have a reputable Medicare Advantage plan? My husband has been offered a plan through UHC.
I think they're a good company, but you always want to look and make sure that's the best fit for you.
Okay, we'll keep going here. I'm on plan A only of Medicare, wanting to sign up for plan B. My question, how can I in the application now during this enrollment period on my own, do this on my own, or do I have to go through an insurance company? I have the form ready to send. However, Medicare.gov said I need to wait until the general enrollment period in January. Should I just wait until then or go ahead and send the application now?
Well, it doesn't, you can send it. I would probably wait a little bit and send it because you're not going to be eligible until January 1st through March 31st. And then Part B would be effective July 1. So you might as well send it in and get it into the system. But again, it's not going to work until January 1. And then you won't be effective until July 1st. Don't ask me why they make these rules. I wish they'd give me a shot at being in charge of it. I can make it really easy for everybody, right? I don't understand these dates and rules. I've been doing this a long time. It seems to be so complicated. Nobody understands what to do. That's just my 2 cents.
How do Medicare and Serving Christian Scientists, or SCS insurance, work together? Is SCS insurance needed if one has Medicare A and B? I guess it's for Rogers and Leslie.
The ones I've seen of the SCS work as a totally separate thing. They are similar to the long-term thing where you have a trigger basically coming to a facility like Arden Wood because you have a particular needs. Becomes the trigger, and they pay you whatever the policy calls, but some X amount of dollars per day. I have seen where they can be used with Medicare, but they are not a Medicare supplemental per se. All they do is provide you that daily amount that they've was agreed upon in the policy while you're at the facility, while that trigger is being activated.
And it's not a large daily amount. So
it's modest, yeah.
Yeah. So if you were covered by Medicare Part A, you could use it simultaneously with your Medicare, and the first 60 days after the initial deductible you're fully covered anyway, if you needed to be here that long. So you would actually be accruing money each day from SCS. That's just your money. It's not necessarily going towards your bill. So that's just how that works.
Right.
Next question. Do private insurers offer 90-year-olds medical coverage similar to Medicare Part B? This is private
well,
insurers now.
Yes, there's no age limit on when you can get a Part D or a Part C plan. So there
This
is
is
no
Part
age
B as in
limit.
boy. Part B
Oh,
as
B
in
as in
boy.
boy, I'm sorry. Right, she can activate, we'd have to wait to that general enrollment period. You can activate it, but you have to think about that because you're going to pay quite a fine.
And do private insurers do that at all as well?
No, so Part B as in boy, that's the government side. So she'd have to have A and B to get some type of a supplement or a Medicare Advantage plan.
Okay.
Did that make sense, Leslie? Did I say that correctly?
So there would be the fine because of the very late enrollment for
Right.
Part B, but then on top of that, there would be a Medicare supplemental plan.
Right.
So sounds like at that point, it might be better to self-insure. I'm just throwing that out there.
Well, that's what I think that's why the question is, do private insurers offer 90-year-olds medical coverage? So could you get private coverage, forget the Medicare, but similar to Medicare Part B?
I don't believe so. No, not after 65. I don't think that's a great stump. I've never heard that. So yeah, I would say no. You've got to activate your B because you've already got Part A. Because if you're 90, you're receiving Social Security, so you've already got A. So that would preclude you from getting any under 65 plan available to anybody in that age bracket.
Okay.
Keep up the good prayerful work.
Is there any Christian Science skilled nursing facility or long-term coverage health insurance available for Christian Science besides Medicare? Is there any skilled nursing facility or long-term coverage health insurance available for Christian Scientists besides Medicare?
Are we thinking for someone under 65 perhaps? And then I'm throwing it to Rogers.
I'm not sure.
The general insurance we found very hard to get to pay at Arden Wood because we're not in anybody's network. Medicare works because it's required by law to be able to include a religious non-medical healthcare institution. But an employer's plan, a private insurance plan, unless you have a Christian Science rider, they've been really, really difficult to get any type of payment from because there's no law that says they have to insure it.
And that's where the National Fund for Christian Science Nursing can be really useful.
Exactly.
Right. Now there are the question did have some long-term implications. It sounded like, John. There is the SHIP, the Senior Health Insurance Program. Pennsylvania. Okay, I'll get that right. SHIP is a long-term care program, and it has been able to be used here at Arden Wood. The SCS, if you have a program, as we've already gone over, if you already have a policy, hang on to it. They are not writing new policies. I have heard that Mutual of Omaha is now offering something, but I have not seen it come across my desk, so I do not know the details.
Yeah, and the outside, Mutual of Omaha, there's a Christian organization called Thrivent. They also offer a traditional type plan that's available out there too. I've seen that. That's a pretty good policy. And there's other options too. There's indemnity type plans. That's just a fancy insurance word, meaning that you get the money no matter what. If it's $200 a day, it would pay to Leslie, for example. Leslie you can spend that on long-term care. You can pay for your next door neighbor to mow your lawn or take you shopping. So a lot of times the indemnity plans give you a lot of flexibility because you get the money and you can do whatever you want with it.
Great. On Medicare Plan G, do you only pay the deductible once a year and there is no copay with Plan G?
Yes.
Okay.
No, that's true. Yeah, it's a calendar year. Yeah, that's very good. Yeah, one time, once the $203 is pierced, you go through that deductible, you're covered at 100% for the remainder of the calendar year.
Here's one. We have TRICARE because of a career in the Air Force. Will TRICARE be accepted as a supplement at facilities like Arden Wood?
Yes, we've been able to use TRICARE several times and have had, easy to work with.
TRICARE for life.
Next, are there any conditions under which Medicare Part A would not pay Arden Wood?
No, unless you've assigned it to a Medicare Advantage. So Part A, original Medicare, we're the ones that make the determination that it's a need for skilled care. I guess that would be the only difference. If it really wasn't a need for skilled care, then we would have to make a decision that you weren't eligible. Or maybe after a few weeks, you've made such progress that you're no longer requiring skilled care. So it's not a given that you have the full benefit period, because we're expecting healing and we want to move you forward, send you back home.
Exactly. Do you need a doctor review for Medicare Supplement Program Part C? Slide said you may not qualify for Part C.
Yeah, just the opposite, and that's probably my fault for not doing a good job explaining that. No, Medicare Advantage, the Part C plans are guaranteed. There's no waiting periods or pre-existing conditions. It does not matter. It's the supplemental ones, the ones that have letter like F or G. Those are the ones that you'd have to answer health questions. You don't need to take a physical, but on the application, they would ask you, have you seen a doctor or been hospitalized in the last 90 days or years? Questions like that. They're just more general questions. But the Medicare Advantage, the ones you see advertised on TV, there's no waiting periods or pre-existing conditions. They'll take everyone.
Here's an easy one. What is CMS?
Centers for Medicare and Medicaid Services.
Perfect.
That's the administrator side to Medicare.
Leslie and Rogers, could Arden Wood share with us how many Christian Science folks choose to enroll in Part B?
I sort of see it, all over the board. As we get the applications in for people, or as I process their stays, some people are fully insured with A and B and supplements, and others A only. And there's I wouldn't say it's 50% or thing. I think it just depends on the individual and their whatever financial decision they've made.
I would say the other category. So there's those that have
Okay.
A only, assuming
This
they're
kind of follows on.
Leslie was answering.
Sorry, Leslie.
I'm going to say a little more. There are those that have A only.
Leslie, you're muted.
Can you not hear me?
You're not hearing.
She's good.
You're not hearing.
We can hear her.
Okay.
Yeah, go
So
ahead.
those that choose to have, just go with the basic A that they have, that would work in a Christian Science facility. Those that choose to have A and B, that can be useful if they ever find themselves in a medical setting where they might need x-rays or emergency care. And then in addition to that, to really make the robust coverage would be to add the Medicare supplemental, which can also, if you needed to be at Arden Wood for an extended period of time, the Medicare supplemental will continue to cover you. If it needed to be for several months, it will go on beyond the regular benefits of original Medicare. So that's also the advantage of a Medicare supplemental.
Next up, when you sign up for Social Security, are you automatically enrolled in Part A?
No.
Okay. I love what.
I can keep telling you why. No, the opposite is when you have Medicare or when you have Social Security, they automatically, when you turn 65, if you have Social Security, they automatically enroll you for A and B. And then we know you have to keep A, but you don't have to keep B.
Great. Also in Part B, can't you use it for durable medical equipment?
Yes
and no. You can, but it will, if you have been in a Christian Science nursing facility, it will jeopardize your ability to use your benefit here. It's called a revocation because it has to be authorized by a physician. So the average scientist, unless they were under medical care, would not be able to use that benefit.
Did not know that, Leslie. That's really good. That's knowledge. I'm gonna remember that now. Okay.
We do loan equipment.
Okay.
We do loan equipment, and that's something that can be very helpful to people if they, in the Bay Area, we can definitely do that. What's the difference between light care, I guess this is for Leslie, between light care and skilled care? To clarify Leslie's note about Arden Wood determining the need for skilled nursing for the use of Part A, there was no medical physician required to be involved to make the decision, question mark. Is that different from one state to another?
No, it just requires the assessment of our utilization review committee for Medicare purposes, which I serve on. And so it's a couple of Christian Science nurses that are experienced will ask some questions about what the care needs are. So if it is care that someone else would be going to a hospital for, then that is going to be covered. So if it is something like a mobility challenge, maybe just someone walks with a walker, or has an incontinency challenge, that is not covered by Medicare. That's more of a long-term care. But if there's a skilled need with a bandaging, or maybe someone's had a fall or illness, that we will make that assessment, not based on a diagnosis, but based on the need for care.
Great. And there was another question about that, so I won't share that. And you've already asked this one and answered it. Is the AHCD, or the Advanced Healthcare Directive, also called a healthcare proxy?
Yes. It's different in different states.
Exactly. This is a random question. We live in Washington State. What would you recommend we do to get updates relevant to us? Jim?
Oh, I thought they were talking about, for Medicare? Is that what they're looking for?
Yes.
Yeah, no, I'm licensed. I work up in Washington. I'd be happy to send you, or try and answer any questions. You can contact me. But they have strong Medicare programs up there. But again, if you're a Christian Scientist, you would want to look at, do they have facilities up in that area?
There is one up in the Seattle area, is it?
And Washington, yes, Sunrise Haven.
Okay.
Could you confirm how many days Medicare covers in the facility with and without supplemental plans?
Up to 60 days of full coverage, an additional 30 days of partial coverage. And then there's also a lifetime reserve option of another 60 days. That's not a one-time benefit period. Could be that you use it early in the year and you're healed, you go home, there's a need 6 months later, you come back, it's a reset, it's a new benefit period. As long as you haven't used it for 60 days in between, it becomes a new benefit period.
What about health savings accounts, or HSA, for Christian Scientists? How do they work? Is it similar to a College 529 plan?
I can talk about HSA. So an HSA is like a medical IRA. And normally you would have one, if you're on a HSA eligible, a high deductible plan, you're under 65, you can still contribute to a health savings account. It's like a medical IRA. And it's tax-free, it grows with you. And once you go into Medicare, you can no longer contribute to an HSA, but you can use those funds for any Internal Revenue Code Section 213D eligible medical expense. That's just the fancy jargon. You can go look that up, but you can use it for dental, vision, Medicare payments, I know the non-Christian Science, but I would assume, Leslie, would they be able to use those monies to pay while they're there at Arden Wood?
Question.
Oh, okay.
I would think that, if they had a health savings plan, that they would be able to tap the money and use it for payment in Arden Wood.
Yes.
So yeah.
This one interesting. I guess this is just a point of clarification. Jim, Kaiser will reimburse visits from non-Kaiser hospitals if you're traveling, so it's not as restrictive as he states. Is that your experience?
No. I've seen it, but I wouldn't count on it.
If it's an emergency, they will. If it's not an emergency, they will ask you to transfer to a Kaiser hospital. And we have received reimbursement from Kaiser. I believe we were the first Christian, and maybe only Christian Science facility that has. But it was quite a demonstration to get that payment.
Yes.
I remember that one. Since Medigap plans are standardized, what is the difference between a good and a bad Medigap plan?
The company, the claims paying ability of the insurance company. You never want to buy cheap. My mama said, don't buy cheap shoes and cheap mattress. Boy, was she right, right? You get what you pay for. Buying cheap, she said, always comes with a price later, and it does. So when you're looking at a supplement plan, if Plan F, for example, is the same and you've got 20 different companies, you always want to look at a good, solid company that's been around, and it's not the cheapest. So you just have to do your homework and be a good consumer. You can go on Google and Google those and see, check about consumer complaints.
Perfect. On the AHCD, if I signed it in New York, will it apply in California?
Yes. But if you've actually moved, it might be good to update it. It's good to review it every year or two, make sure that the individuals that you've named, their contact information is still current, that they are still current and able to act in that role. So
This is kind of tricky. With regard to the living will, is it possible to name more than one person as the person with authority? My time is split between 2 different states.
yes, you can list several people. You can put them in order. If one is not available, they'll automatically go to the next one. So if you were on the West Coast and you were, the relative was on the East Coast, you could go to Plan B, which was the second person listed on the wherever you are. They don't have to be where you are, but they do need to be available.
Right. How do I move from Medicare Advantage to original Medicare plus a supplemental plan?
Well, you can do it right now between October 15th through December 7th, right? But you remember, if you have to qualify for the supplement, so a suggestion would be to contact the supplemental company and find out the health questions and see if you can qualify. Then if you do, you disenroll during this period, October 15th through December 7th. That would be effective January 1, and then your supplemental plan would also start January 1. But you want to make sure you can get the supplemental plan first. You don't want to cancel anything until you're assured you can get that.
Thank you. Is there any limitation for Christian Scientists if they choose medical first, then Christian Science facility, or vice versa?
Not for the first, but for the second. So once you have chosen to use your Medicare benefits in a religious non-medical healthcare institution, they don't like you going back and forth. So if you do choose to have medical care after that, it's called a revocation of your election to use that benefit here. So you're allowed one for grace. So the next time you want to be in a Christian Science facility, you can do it without penalty. If you do it a second time, that is seeking medical care after you have stated that your choice is Christian Science care, you will need to wait 1 year before you can use that benefit again in a Rinky. And if you do it again, it's 5 years. So if you have had medical experience in the past and you've never elected to use your benefit in a Rinky, there is no penalty involved. It's just once you have that election form in place, it stands. But you can always go back to the medical. There's no penalty for that.
A couple more questions. Go ahead.
And just on that too, that doesn't mean you can't come to Arden Wood. It just means that we couldn't get Medicare to pay for your stay here. So we would have to use one of the other options we talked about, maybe National Fund or things like that.
Good catch.
Yes, we always try to ensure that or ask that Christian Scientists come to Arden Wood, and we will figure out a way to help pay for this care. We want Christian Science care to be your first choice of care, and we'll work with you to make sure that financing works in some way. If a Christian Scientist uses Part B for bone setting or an X-ray, does that jeopardize using Medicare at a CS facility? You kind of touched on that, Leslie, but just confirm that.
I think I would say if somebody, let's say somebody had a fall and they suspected that something might be broken, it would be wiser to first go and have the X-rays taken before being admitted to the Christian Science facility. It would avoid any complication in that regard. but every case is individual. So, you'd want a really good assessment, certainly talk through options, and it's your choice whether that is what you choose to do, have a bone set or not. And just the ability for a Christian Science facility to meet that need and care for it if you opt not to have a bone set. I'll throw that out there.
Jim, can you give the name of the Christian insurance company again? Is it Thrivent, I think?
It's called Thrivent. It's the old Lutheran Mutual and the Aid Association of Lutheran, excuse me, they combined it. It's called Thrivent.
It was Lutheran Brotherhood, right?
Oh, I'm sorry, not Lutheran Mutual. Yeah, Lutheran Brotherhood and Aid Association of Lutheran, John. You're right.
Growing up in Minnesota, we heard a lot of Lutheran Brotherhood
That's
when I was
right.
growing up.
Yeah, strong, very strong, financially solvent company for sure.
Can you explain indemnity that you mentioned?
Sure. That means, so if I had a long-term care policy and the benefit was, say, $200 a day, they're going to pay me that benefit in cash. Or if it's $6,000 a month, for example, I get that benefit paid to me no matter what. There's no restrictions. I can use the money in an indemnity policy to pay for care, to take a trip to Hawaii, to have my grandkids fly them out and help take care of me. I can do whatever I want with that money. It pays no matter what. It's going to pay out. Normally those policies are a little more expensive, but I like them because there's no insurance company telling you what you can do with your money.
There are so many questions still to go, but let's do two more. We're coming up to the 5:30 time here, so let's just do two more. And then I guess we'll look forward to that January meeting when we can answer more questions. And you can always reach out to Jim or Leslie or Rogers, as mentioned earlier, and we'll leave that up at the end of this segment here. I'm a Christian Science nurse who is still working and on Medicare A and B. With what you said, should I get off Medicare Part B?
Yeah, I'm not sure. I don't want to mess anything up for you. As a non-Christian Scientist, I would say, yeah, you don't want to be on Part B because you're paying for something you're probably not receiving. Because when you're working with more than 20 employees, your group health plan is the primary payer. That's why the government says, hey, listen, you should probably sign up for Part A because it's premium free, and that would pay secondary to Medicare. So you can disenroll from Part B. It's not that difficult, and it's easy to sign up again for a special enrollment period. But again, I can't speak to the Christian Scientist, Leslie. You'd have to help with that.
So that would only apply if she were indeed in a group health plan.
Right.
And I don't think a lot of Christian Science nursing facilities may not have that available with 20 or more participants. So I would say it's a very individual choice whether you choose to have Part B or not. I think we've stated why it is an advantage. Yes, it's something you're paying for, but it's also something that should you need to use it in a situation, I will just tell you care is very expensive. So it's just something to consider.
Exactly, and that's why we're offering these webinars, because I don't think Christian Scientists in particular are in tune with how expensive care can be. So that's why we want to be as well prepared as possible. Let's have this last question. I have a financial advisor. Jim, how do I find an insurance advisor?
Look into the camera. No, I'm just kidding.
That was a softball for you, Jim.
Thank you. Yeah, I'd be happy to help. Just guide you in any way, whether I work with you or not. I'd be happy to try and, if you're in another state or anything like that, I'm happy to try and help you and point in the right direction. Whether we work together or not, that's totally up to you. But yeah, I'm happy to assist.
Wonderful. Let's leave it at that. We'll get back to you with information about a January webinar. But Leslie, Rogers, and Jim, thank you very much for a very worthwhile presentation today and good question and answer period. And thank you all once again for joining us today. We hope to see you on December 6th for our Christmas celebration. We wish you a very happy Thanksgiving. We all have so much to be grateful for.
We do.
Goodbye for now.
Bye, everybody.
Bye now.
Mhm.